blue light filters out there. Are these really beneficial?
Actually, that is to protect you from the sunlight outside because the sunlight has like very sharp UVA and UVB rays. So directly looking at the sunlight can lead to something called as solar retinopathy.
When we go for our eyesight check, I've often observed one doctor gives you a different number altogether, and when you go to a different doctor, the number is increased or decreased.
Technically, that should not be happening. There are like two ways to measure the refractive error in the eyes, right? So you do an objective testing and then you do a subjective testing.
Listeners, just before we went to sleep last night, many of us did the same ritual. Lights off, room quiet, and then a screen lights up. One last scroll, one last reel, one last reply. And in the morning, even before our feet touches the ground, the same screen becomes the first thing that meets our eye. And we really pause to ask, what is this doing to the most sensitive organ of our human body? And not just our eyes, but our focus, our nervous system, and our long-term health. And today's conversation is about these silent habits, the cultures that we normalize, and everyday choices that can either strain or heal us. And to help us make better choices, today we have Dr. Priithikka with us. Hi, Dr. Priithikka.
Hello, hi Pulkit, how are you?
Doing great, doing great. Thanks a lot for accepting our request to be on the podcast.
Of course. It's great. Yeah.
So why don't you introduce yourself, Dr. Priithikka, to our listeners?
So I completed my MBBS and went on to do my MS in ophthalmology. I've generally been interested in public health, and that was something that I had actually applied in Hopkins and I got through. And currently, I'm pursuing my MBA at IMA and learning so much from everybody. So it's just been an entire roller coaster ride. And currently, I'm working and pursuing my MBA. So I am at Aravind Eye Hospital, I mean, Aravind Eye Care System. It's our family run organization.
Why don't you share a bit about the Aravind Eye Care? Because, I was part of Jagriti Yatra, and since 2014 until today, Aravind Eye Care is one of the role models, Yatris visit every year. And I'm myself amazed by the work that Dr. V started out there. So why don't you shed some light on that?
It's so pleasant and nice to hear that, there's so much recognition. So Aravind Eye Care System is a 50-year-old organization. Like actually a very interesting fact, we're turning 50 this year.
Wow.
So it began to provide service. It began to help the people who could not afford eye care. And eye care is something so basic. So when it comes to the eye, until something actually happens to it, you do not realize how important it is. And when something happens, and when you go from like somebody who can see everything, even to like basic colors, to going completely blind, is when you realize how important of an organ it is, because that is your connection to the world in a certain sense. So he started off with the vision to provide affordable and good eye care to the poor patients, and not just the poor, to like everybody. And to make this more accessible, he started the Oro Lab. So the Oro Lab is our manufacturing unit where we make our own lens. So when he first initially began, a lens costed about 20,000 rupees, and we were importing this from foreign countries. So he was wondering how do we make this, how do we make this possible in India? Like we have so much manpower, we have so many people, and how do we bring that at a low cost to India was one of his main visions. And that's when he started producing his own lens. And these lenses were like produced for say 200 rupees when it first began. And that's when he could start bringing the affordable eye care system. And this further grew, and currently we have like so many subspecialties in eye care, and I think it's one of the most advanced fields in a lot of sense. So there is like so there's so much, and he's brought in everything under one roof. So that is a little bit about the hospital.
One of the my favorite case studies was Aravind Eye Care, when I was a Yatri in 2014.
Oh,
And
nice.
eye care, I totally believe, is the eyes connect us to the world. We are able to actually appreciate the beauty out there because we have eyes today. And
Yes.
a lot of people, even including myself, we are not paying enough attention to its health. I recently got a shocker of my life where my eyesight just doubled. And I
Oh.
was like, in so much shock for 3 days. How could it happen? Just 6 months, my eyesight doubled. But then I decided to do a check, in the hindsight, what habits did I do, which, really led to this particular place where now my eyesight numbers have doubled. Uh, so one of the habits, I used to do, and I'm trying to eradicate it from my daily lifestyle, is what I just said at the start of this podcast: turning off lights before sleeping and gazing at a favorite OTT platform or Instagram, LinkedIn, any other thing. So, what are your thoughts on that, and what would you recommend?
So I think like as an entire generation, we've moved more to like near and close work rather than like distant work. So probably when we were younger, we used to play outside in the evenings. We at least had that kind of a break before mobile phones came in. But right now, I don't think children even have that, right? So their evenings and when they eat or whatever it is, everything they're distracted using their phones and near work. And so the eye, just like every other part of your body, is also supplemented with muscles. So they also have muscles. So constant near work could cause constant contraction to the eyes, and eventually your muscles also tend to become weak. So that is one of the factors that we're seeing. So we encourage children to play outside, and as adults also. So it's not just like an eye change that happens when you start using screen in the night, it's also a bodily change, right? So towards the evening and towards the night, your cortisol is supposed to come down. So that's our circadian rhythm. You wake up in the morning with good cortisol, and towards the day, I mean, end of the day, it's supposed to come down. And when you again reinforce green light or blue light to your eyes, then you're again, you're confusing the body with the circadian rhythm. Wait, is it morning? Is it night? You're reinforcing cortisol. So there are so many such factors that come in. So that is something which is very disruptive, but also that's something that we've grown very far away from controlling at this point.
I totally agree. But help me understand, Dr. Pritika, that today everything that happens, including the podcast that we are recording, is on a laptop screen. Earlier, even the work at offices was done using notebooks, registers, and few other, methodologies out there. But today, you have to send a message, you drop an email, or you use WhatsApp. You have to call somebody, or picking up your phone. Everything has got a screen time coming in. Even this Sunday, I got my screen time notification on my laptop, which said that my screen time has gone up by 109%.
My
Now,
God.
and this is just what I'm using my laptop for my work. I'm not watching any OTT on this device. So if my work hours are increasing, and today anything or everything we have to do is linked with this small compact box called laptop. You cannot do anything except without this particular box. So what do you suggest?
So the one thing that I suggest for my patients also is to follow the 2020 rule. So the 2020 rule is, say 20 minutes I look at the laptop or 20 minutes I look at the monitor and do some near work. Take a 20-second break and look at the distance. So look at any point in the distance just to give your eye a break. Shut your eyes for some time just to like preserve your tear film, or just to preserve like the hydration in your eye. So these are some practices that I tell them. So realistically, it's not possible to tell people, like you said, to stay away from laptops or like computers right now. Like we ourselves, we have an electronic medical record system. So we do enter our patient details on the monitor ourselves. So it's become quite impossible right now to say that, but these are some precautions that they can follow. And if you feel there is a lot of dryness, then we give them some lubricants to like further supplement the hydration. But these are some things that you can do, follow the 2020 rule, or just close your eyes for some time whenever you can. In the evenings, maybe try doing more distant activities, just go outside to play, just do anything that does not involve your screen time. So these are some things that you can probably follow.
Understood. Understood. Um, while I was going through some of the scriptures that are written out there, you mentioned about distance. So distance was one thing that was written out there, that our eyes were built to look into the distance. And at the same time, the very first light was the sunlight that we were supposed to be exposed to. But today, the very first light is the mobile screen. So
Yeah.
how can we differentiate between the two lights from the science perspective, if you can shed some light?
So when you're talking about the sunlight, I would say is more for a bodily function, and it's not per se for the eye that they're talking about. And anything, so any kind of activity that you do like early in the morning must be beneficial to you, right? So you're waking up and you're looking at like an artificial screen. And these are the same things that build on throughout the day. Like I said before, your tear film protects your eye. It provides hydration to the eye. So exposing it to like sharp light in the morning could cause like dryness to the eye. And early morning, like you said, you need to go out and breathe some fresh air. So when it comes to the phone, it's not just about using the phone, right? You're like shut in. You kind of don't do so many other activities that helps your body. Like they say, morning sunlight, there is vitamin D, and morning you wake up with a lot of cortisol, and that kind of needs to come down. So that is why sunlight is very important. So it's not just for the eye that we particularly say that, but the eye is again your window to your brain. So you're kind of telling your brain that, like I'm up and I'm like already using an artificial light. So that is something that could be disruptive. But in term, but like direct effect to the eye, I would probably say dry eye, like, commonly using it continuously could like lead to dry eyes.
And we have been hearing a lot about these blue light filters out there. Even in lenses today, we have these blue cut lenses coming out. So are these really beneficial, or to what extent do these safeguard our eyes?
So I would say not very beneficial for the monitor screens or the computers, because even the computers and monitor screens have those UV protection stickers, I suppose now, right? But actually that is to protect you from the sunlight outside, because the sunlight has like very sharp UVA and UVB rays. So directly looking at the sunlight can lead to something called as solar retinopathy. So there are damages that could happen to the eye, and these are all protections from that. And even something as basic as a pterygium could develop. Now, pterygium is like a tissue outgrowth on the eye. So something as basic as that could develop on like common exposure to the sunlight, right? So all these are protective factors for those per se. And for the screen, I honestly don't believe that, it's going to greatly help. But there is no harm in wearing it, is what I would say. There are still like more side effects to like doing so much close work than the UV rays that you're going to get from your monitor or your screens. That's quite marginal.
you know, Again, being busy in our day-to-day life, the way we have to follow our schedules out there, we often ignore the symptoms that are showing up because I believe our body talks to us. It's who
True.
we are, who is not listening. So, in your experience, when it comes to eye care, we adults primarily, I will not take a look into the children because,
Yeah.
again, they are learning from us. Uh,
True.
what are the symptoms that we often ignore, which, when convert into something more serious, are brought to attention?
I think one of the most ignored disease in India is diabetic retinopathy. Like how much can diabetes affect your eye is generally ignored until something really big comes out of it. So we've had so many patients who walk in and say that, since last night, I have no vision in my left eye, and you examine their eye and there will be so much hemorrhage inside. So we generally call that vitreous hemorrhage, and that is not something that would have occurred in a day. That would have been a process over like years. So having high diabetes, having, uncontrolled and like varying diabetic levels frequently would lead to this and would lead to something so drastic. So type 2 diabetes, especially as soon as you're diagnosed, you have to come in for a checkup, like what we call a retinal examination. So patients need to walk in for that. So that awareness is pretty low outside, and they come like only when it actually affects their eye. By actually affecting, I mean something that leads to a surgical level of intervention. So very few patients actually realize the side effect of it and actually come in early. So that is one thing that we commonly see in adults, and India being one like the diabetic capital. So I think that requires a lot more attention.
Got it. Got it. And, you know, talking about the adults, but let's also focus on children a bit. What I personally believe is that today children are born with mobile phones in their hands. Uh,
True.
from a very young age, probably within just months of their growing up, mobile screens are introduced to them. How is mobile screens impacting the child's growth, starting from, a baby, then to a toddler, then to a teenager? How does it really impact the growth of the eye?
So basically, as you grow, your eye also grows, right?
Yeah,
So yeah, that is also like any other organ in the body. So that also grows in size. And one main factor for children, wearing spectacles or developing any kind of refractive error is, of course, genetics. Say both your parents are myopics or both your parents are wearing glasses, then of course, like there are very high chances that you would also be wearing the same. But it's like we're further supplementing it with again doing a lot of newer work. Like I had mentioned before, a lot of our work, I mean, our eyes are also made of muscles, right? So again, a lot of near work, a lot of contraction. It's like holding weights for very long. Like how long do you think your biceps can, like, be in a position where you can hold on to, like, say, a bag of something heavy. So you're contracting your biceps when you do that. So you're kind of doing the same thing to the eye also. So when you're constantly doing so much near work, you're kind of contracting all the muscles and you're like stressing your eye out, right? So that is a problem that probably parents also don't realize, or maybe they realize and it's just gone beyond a particular point right now. So that is one reason why they end up getting refractive errors also, but predominantly genetical, and also all these other factors. And also that is, I feel, the age where we can encourage them to play outside. Like you said, as adults, it's nearly not possible for us to do so much of outdoor activities with all our commitments, but that's one age where they should be doing all that.
I agree. I totally agree. When I was a kid, I used to be mostly out playing cricket or whatever sports we could get our hands on. But yes, with advent of computers coming into our lives, those hours reduced drastically because after a particular point of time, everybody was like, okay, let's play FIFA, but on computer.
I
So
know.
the outdoor games changed to computer games completely, and I have myself been, doing
A
that.
victim of those.
Yes. So, yep. Um, any particular anecdote you would like to share from your experience, Doctor, out there? In terms of, the way you have seen eye care evolving or not being taken care of with the patients in your experience you have seen, over the years.
So I actually think that the awareness is better now, to be very honest, at least like in terms of the urban areas. And so I think people are actually actively walking in with these kind of questions. They just walk in and they say, doctor, this is what I've been doing on an everyday basis. So I've just come in for a regular checkup just to make sure everything is all right. And what do you suggest for things to get better? So I honestly think in a lot of ways, the awareness has become better, but we're still like reaching out to a certain community, or like or a certain set of a population where such awareness could probably not reach. And that is something that we're actively taking up and doing right now. So I would actually say, in a lot of terms, though our activities have worsened, our awareness has become better.
Understood, understood. But I believe that, as you rightly said, awareness requires action as well, and that
Correct.
action is missing.
Yeah, that's very true. You walk in, you ask something, you listen to it. It's nice to listen, but then you just go back and do the same thing. Like, actively, being consistent with a certain behavior is pretty difficult that way.
Understood. Understood. Help me understand one thing on the eye checkup front when we go for our eyesight checkup out there. I've often observed where one doctor gives you a different number altogether, and when you go to a different doctor 2, 3 days later, either the number is increased or decreased. Do a very drastic difference. Why does that happen?
In the refractive error sense,
Yeah,
um, technically, that should not be happening. So basically, they should not be like a drastic change in the refractive errors, like you're saying, when you like measure it on one day and then immediately after. So that should not be there. But again, like I was saying, there are like two ways to measure the refractive error in the eyes, right? So you do an objective testing and then you do a subjective testing. So the objective testing is by using a machine which we call as the autorefractometer. I'm sure you must also know about it, like where you like measure the refractive index, I mean, errors individually in both the eyes. And then you do a subjective testing for a patient where the patient sits at a particular distance from a particular chart, and you place like different lenses and you measure the refractive error in each eye. So these are the two methods that you do. But in maybe in a lot of places, when you do not have like a proper optometrist, the only way they check could be with an AR machine or an autorefractometer, which could really vary from the subjective power. So the subjective power is what you as a patient are telling us, like your acceptance to the chart, which would not be the same as what the machine reads. So that could be one factor. And there are certain other factors, such as, say, an accommodative fatigue, like I said, the muscles being a little fatigued through the day, or also in case of diabetes. So, in case of diabetes, you would see like a frequent change in power because your lens gets accumulated with water and there is like a frequent change in power. So, these are some of the reasons. But predominantly for a normal adult, there should not be a great change when you measure it within a couple of days.
optician said that the best time to get the eyesight checked is in the morning. So what are your thoughts on that? And is it backed by science or it's just
So,
something that
like
was
I was saying, it's just the accommodative fatigue, right? You're just more fatigued after being whatever, doing whatever throughout the day. But again, it should not really cause a big difference. So, it's again your acceptance and what you see on the chart. So, it should not really cause a big difference, but it could be a little better in the morning because you're more active and you know what you've not like exhausted yourself through your activities through the day. So, that way it could be slightly better.
understood.
Yeah.
Understood. And can you help us understand the role of the diet that we intake in in our eye care?
So that way, I think it's for the entire body, right? So just like any other part in our body, our eye is also made of the same kind of vessels and the same kind of neurological supply. And adding another fun fact here, that eye is the only organ where you can see your blood vessels, right? So when we do a retinal examination, we can actually see the arteries and the veins in the eye. So that was just a fun fact. But anyway, so just like any other organ in the body, the eye is also supplemented with the same nutrition. So it's the ultra processed food that you're eating which could cause a disease in the eye, or it's your diabetes which would cause a disease in your eye. It's your hypertension. So many of the bodily diseases equally have an effect on the eye. So it's not an individual organ in that sense. So and like vitamin deficiencies also, right? So vitamin deficiency is also predominantly seen as some characteristics or some diseases in the eye. So just like everything else in our body, I think our diet also has an influence on the eye.
One of the most common factors with increase in screen usage, we are getting back to screen usage again, uh,
Yeah.
is the dryness. We discussed about it, and hydration becomes a challenge. While the lubricants are available, which are often prescribed, but what as a normal human being in my day-to-day habits I can do to better manage the hydration of my eyes?
So the hydration of your eyes is predominantly with the activity that you do also, right? Because your eye is protected by something called as the tear film. So the tear film is not just made up of like water, it's also made up of like mucin and like fat, and there are multiple layers to the tear film which protect your eye. And damage to any one of these layers could cause like evaporation of water from the eye and thereby leading to a dry eye. So it's not just hydration per se. So hydration is as important as it is to any other organ because again, eye is also made up of a lot of water. So it's as important as that. But for the dryness of the eye, the topicals generally work better because the eye is made in such a way. So you have like a layer of fat or like a layer of mucins to protect the water from evaporating. So to prevent those is why you supplement in all those. So I wouldn't exactly say hydration per se would help this particular reason or this particular disease in the eye. Yeah.
But often it is said that if you're working in an AC room which is probably in offices, so you should keep a
Correct.
glass of water on your table. It will help with not letting your eyes dry. Again,
Okay.
is it a
Are we
myth
all
or it's a
following
fact?
that? So I think that is just like a humidifier, right? Like I think it's just similar to a humidifier. So like I said, the barriers in the eye protect the water from evaporating from the eye, just to like put it down on simple terms. And like constant, AC or like constant any kind of air like that to the eye causes disruption to the tear film. And again, there's evaporation and there's dryness. So I think a glass of water is kept for the humidity factor here. There's a lot of physics and chemistry involved in that, but yeah, looks like that's the reason.
Understood, understood. Got it. Any specific, recommendations you would like to give for the listeners on enhancing the eye muscle strength?
So we do a couple of exercises, but again, those exercises are directed. So we see the accommodation capability of the eye. We have a couple of tests for that, to even see the muscle strengthness and what your eye or strengths and what your eye can do. So based on that, we give like a couple of tests, like a pen and pencil test, and so those are like advised based on what is this one for the patient. So I don't think it's more of a generalized advice. Yeah.
Understood.
Yeah.
Understood. And any recommendations you like to give to organizations to make the workplace more eye health friendly?
Eye health friendly. Okay, let me see. So maybe start by sticking a vision chart and placing a sticker for patients to, I mean, for like, sorry, employees to like just have like a take a minute break and maybe read so that they're aware of something, if if they're not able to like see properly in either of the eyes. And also, maybe when you have somebody with diabetes, like I said, diabetes is something that we very commonly see. So, encourage them to go for like checkups. I'm sure you have like employee checkups in, yeah, a lot of organizations. So maybe encourage them to go for like retinal examinations, any other disease in the body, let it be diabetes, hypertension, autoimmune, any other disease, just encourage them. So all these are some of the things that they can possibly do. Yeah, but again, like for a fun fact, you can just like stick a Snellen's chart and ask them to read to begin with.
Amazing, amazing. And before we, conclude Dr. Pritika podcast, any final message for our listeners?
So there's a message that there's a like quote that Dr. Wee says. It says that so much is done and so much is still left to be done. So that is something which I really find close to my heart. So I think we've done so much, but we're still a long, I mean, there's still a long way to go and so much to do. So I think we just have to remind ourselves of that every day and look back and pat, but also look forward and, keep going. So that's something that I would like to say.
Thanks a lot. Thanks a lot, Dr. Pritika.
Thank
And
you so much, Pulkit.
listeners, if you have any questions, let us know. You can drop us a comment or DM us. And if there's one truth today's conversation reminds of us is healing doesn't begin in a crisis. It begins in awareness with action. It is how we treat our eyes when no one is watching. And I hope with this podcast, we all will try to reduce our screen times when the lights are off and not the first thing in the morning as well. Thank you. And remember, until next time, we are listening. Thanks.
Thank you.